So this was at least in my perspective, a pretty interesting abstract and study. I think when with the use of gemcitabine and nab-paclitaxel, the principle there is that nab-paclitaxel, if given before gemcitabine, would increase the intratumoral concentration of gemcitabine. So I think biologically, the idea here is to see whether by giving gemcitabine a little later after nab-paclitaxel, whether that increases the efficacy of the regimen. So that was the overall arching kind of objective of this study. Yeah, I mean, I don't recall the actual percentage, but in my kind of recollection of the poster, the majority of patients were able to get gemcitabine after nab-paclitaxel, just because even in the sequential group, they received the gemcitabine essentially 24 hours after the nab-paclitaxel infusion. So clinically speaking, I wouldn't imagine that many individuals dropping out of treatment. Again, in this study, the results were not significant. There was a trend favoring the arm that received gemcitabine sequentially after nab-paclitaxel. I would have to say that the study here is also quite small. They had about 70 individuals in each arm. So I think if it was a larger study, which might be the next step here, there could perhaps be a role for the sequential method of delivery. I mean, I think the study is, thought-provoking and hypothesis-generating. I don't think it will alter my, current way of delivering this combination, just because, again, the results were not statistically significant. It is quite interesting, though, and, I wonder whether the investigators would be, keen or open to maybe doing a larger study, because there was a trend seen. I mean, the short answer is I think yes. Gemcitabine and nab-paclitaxel is really well tolerated, at least in my clinical opinion and experience. So again, if they then fail or the disease progresses while on that treatment, because it's so well tolerated, I would hope that more individuals would be fit enough to get second-line therapy. So again, this circles back to the Napoli study. I think that represents a good second-line option. So again, I do think it does alter the landscape of second-line therapy a little bit.